Most of us familiar with this topic. Fiber. If we see the definition of fiber, it's a food material, or we call it an undigestible plant material which is not digested by the enzymes, but that may be digested by microflora in the gut. Now, a few characteristics or the function, if we see, major ones: improves large bowel function, modifies blood glucose level, cholesterol in blood, immune functions, blood glucose lowering function, lowering cholesterol, and the hormone release, the gut hormone. So when we see the old concept, we were only looking at the major 3 nutrients, then we looked at the 5 nutrients, and now we are looking at the 6 nutrient, the fiber as 6 nutrient, with other important functions because of the chemical structure of the fiber. So the newer concept, when we see the fiber is included with resistant starch, inulin, vitamins, and other components, the isoflavones, the polyphenols, the phytochemicals, and many more things go with fiber. So if the benefits are looked at, we know that colorectal cancer, this was the prime thing which brought the emphasis on the fiber as the 6th nutrient. And we see the fiber as diabetes and the gut health is the most important for the gut microbiome, and the constipation we all knew, and now the obesity and other CVD which are related inversely with the fiber. So when we look at this risk factors, we all know that obesity is 1.5 billion epidemic, world epidemic, and the relation with this, the consumption of the fiber has gone below recommended level in recent area, and that is what is leading to these the diseases. So what we are looking at, that what was it that protecting us earlier days from this disease was more of the plant fiber which were consumed by the most of the peoples. So now we do have, because of the raw consumption, we do have extracted fibers from plant sources which are incorporated into meal to increase the fiber intake. Now we see the recommendation, if we say 35 to 40 gram per day, and the minimum, the recent study shows the reduction is as low as the 17 to 25 gram. Now to some potential effect, if we see, we all know that fermentable carbs, the potential effect with synthesis of short chain fatty acid, and the most important which we have just put up here, the increasing energy density, bulking effect, weight gain, and this satiety effect. The gut hormone increase or decrease, inflammation decrease with CRP and other inflammation, and the gut microbes. So the risk of type 2 diabetes reduces, insulin sensitivity reduces, gut transit time reduces, hence reduction of glucose response, total and LDL cholesterol, and gastric emptying. So let's look at some of the sources. So insoluble and soluble, we all know 2 types: oatmeal, nuts, beans, vegetables, all with the foods, high fiber cereals, which are insoluble. Some are soluble and insoluble both, and mainly the soluble ones is oat, barley, rye, and the rice bran, which is insoluble, of course, and the bananas, citrus fruits. So these are the sources which we consume in our day-to-day life, and the fiber supplements are made from the extracted fibers from this, like glucosamine, galactosamine, psyllium, guar, beta-glucan, wheat-doxyrin, and these supplements are used widely for controlling or affecting many diseases. So if we see the most important properties of dietary fiber is 4 main properties: water holding capacity, the absorption, the fermentability, and the viscosity. These 4 properties changes our gut flora and impacts has inverse relation with the many diseases. So the weight management, when we look at it, is reduces the calories, promotes satiety, and enhances microbiome. If we see the proposed mechanism, fiber-rich food usually have a lower energy content, which contributes to a decreased energy and density. It increases the density of the diet. The foods rich in fiber needs to be chewed longer. It is said that we have 32 teeth. If we chew every morsel 32 times, I think we will have an early satiation, and there will be a reduced intake of the food. and then thus it also slows down the absorption of nutrients. And when it is delaying the gastric time, it absorbs the many of the nutrients there is time. So it is beneficial in this, in the intestine. And of course, we have seen the relation with different gut hormones, which regulates the satiety and energy intake and pancreatic functions. So fiber is related to this, the consumption of fiber. So if you see epidemiologic studies, it shows the Dronosky stated that fiber content has a great impact on the palatability of food. And because it is affecting the palatability, it reduces the energy intake. Secondly, the many studies also say the great satiety due to an intake of dietary fiber has been reported against the simple carbs. So the one important fact here is the ability to displace the energy from other nutrients by adding bulk and weight. So this again will add to the satiety and the reducing hunger. Then we know the problem of obesity worldwide, and the consumption has gone down because of the many factors. So it was understood that the vegetarian consumed the large amount of fiber, and that's why they had a less obesity and other epidemics, other diseases. But most of the vegetarians also are obese these days because the consumption has gone down. So if we see the studies, cross-cultural studies, 16 cohort, we see reduced intake of fiber was an important detriment for body stores. So it also affects the body fat stores. The study done, 3-day record study done by Alfie et al. So with normal weight, moderate weight, and severe obese group, the BMI study, authors showed that fiber intake was significantly higher in the normal weight group and inversely associated with BMI with adjusting the several confounders. The Predimate study shown that significant increased relationship between total dietary fiber consumption and body mass index in abdominal and waist circumferences. Now we see here the studies associated with fiber and body weight. So many of the studies, the meta-analysis shows the cross-sectional ones, the 10 years follow-up, and the other studies, the 20-month follow-up also, that in this group, the significantly higher in the lean group, those who were lean, they had a higher consumption. Then there is a reported intake of carbohydrate, complex carbohydrate, and dietary fiber were inversely related with the body fat. So this studies show body fat, your BMI reduction, your weight reduction, and your waist circumference and abdominal girth reduction. Now, if we look at the studies of the dietary fiber, the direct fiber, extracted fiber, like glucosamine, guar, and guar gum, and the xylem, and there is an alginate and glucosamine fiber also. These studies directly also relate, showing the evidence that it is having effect on the weight. So the weight loss and weight regain is not there when we have the enough fiber supplements or dietary fibers along with these supplements. So if we look at these, all these studies also having direct relation with your body fat and body weight. I'm not going to go into the detailed study, but directly come to the table which clinically demonstrate the health benefit associated with common fiber. If you see these health benefits, it is shown that the last one, the xylem, that's the husk, which is positively related with all. So these are the evidence-based approach for fiber supplements to tell us what to look for and how to recommend these supplements with these evidences. So most of them are having only 1 or 2 effects if you look at it as weight loss or look at it as the constipation or a bulk or a diarrhea. But you see the last column, that's the soluble fiber coming from isabgol husk is recommended for most of the things. When you see the fiber role in glycemic control, the Slevin et al. Have shown that the postprandial glycemic response, because of its effects on gastric emptying, you can see these 5 studies which is showing you the low versus high with 95% of IC. So 100%, 95% there is a glycemic response with fiber intake. Then we see the type 2 DM prevalence, I mean the decrease in the prevalence, that's 21% to 82% with quantiles and quartiles of fiber intake. And the whole grain intake also led to 21 to 30% across quintiles, with again 95% IC. So these are the evidences telling us that the fiber is not only related only to obesity, weight gain, type 2 DM, glycemic control, but even to the prevalence and the prevalence of or the retarding the onset of diabetes in these patients or in the population. Now, if we see the follow-up studies of 10 years and 8 years, these studies do confirm the relative risk ratio of type 2 DM reduced risk. So, if you have throughout your life stages good fiber intake within the recommended allowances, then I think the risk of diabetes goes down. So these are the studies with umbrella review. If one of the studies published in recently 2018 Journal of Chiropractic, it shows that the reduction in fasting blood glucose, if you just see the mark in blue, it also shows the reduction in the insulin concentration, and it also shows the reduction in your HbA1c. So these are the recently published studies and meta-analysis. So these studies tell us that it is having not only effect in preventing or also in the control of the studies. So if we look at the ratio, so most of the studies do not give the ratio, but what we see in practice or the Nayak and Natters say that 30 to 40 gram with 50% of soluble and 50% of insoluble when we have intake, we will see these effects or the benefits in the with the mechanism in these relative conditions or the metabolic outcomes. So when we look, also my topic included smoothies. Though there is not an evidence, much evidence about the smoothies, but what it does is, it's just a blend of a different fruit fiber or a different mix of fruits and vegetables which is consumed between the meals. Okay, so it has a trend to leave behind a pulp because it's not like a juice. It does have a fiber, intake fiber in the blend, and therefore it is helping us to get the fiber from the smoothies. So what does it why the common problem we see in these days is changing lifestyles. People are just sitting and sedentary work. You don't have time to have your 3 regular meals. So when you don't have time to regular meals, you tend to binge in between. So when you take in between the meal, the smoothies, you will get your fiber intake. And what you missed in the main meals, the fiber, you get it from there. So plus there is enough food availability, there is a meal skipping, multitasking, you don't even remember. Most of the people only snack and don't have meals. So these smoothies are the best options for these people and for the current lifestyle. So they are the richest source of fiber and micronutrients, especially vitamin A, selenium, potassium, iron and magnesium. In just one blend or one meal, you can have all these, and which other nutrients will also have the beneficial effect. So the UK studies showed that fruit in, I think last slide, vegetable intakes are under consumption. So what will say that the intake was low, the below the lower reference level, also lower reference nutrient intake, and therefore in between to bridge the gap, these smoothies came in between. So mainly the smoothies were introduced just to bridge the gap between the meals and increase the fiber intake for this. So 18.20 to 59 had average intake of 18 to 5, and AOAC guidance said 30 gram of fiber daily was required. So research suggests that it could have a satiety effect and possible benefit to endothelial function. So to summarize, the Predimed study showed dietary fiber intake were associated with reduction in total mortality, all-cause mortality. Evidence analysis library concluded that dietary fiber intake may improve serum lipid, lower blood pressure, achieve glycemic control, reduce inflammatory markers, indicators of inflammation, risk of CVD, and total fiber intake has been inversely associated with low density LDL and SDL and reducing the colorectal cancer, which was much earlier as evidence. Fibers have a potential to modulate the gut microbes. This is again an important function of the fiber, which keeps your gut healthy. So meeting the recommended intake of fiber throughout an increased intake of plant-based food has potential effect on the leading chronic diseases. So there were studies which said when you encourage increased fiber intake in your every 2 consultations, 3 consultations, you will have, at all stages of life, the benefit of effect will be given. And if 1 gram increase of fiber, if is there in your 1 meal daily, it will also give effect to reduce like 0.25, 250 gram of weight loss. Thank you.